I'm Carter Oosterhouse, and right now we're in South Philly. We're working with Habitat for Humanity, Merck, and the Asthma and Allergy Foundation of America.
We are on Latona Street in Philadelphia. Habitat for Humanity Philadelphia started 26 years ago. We're really excited. We've helped 156 families into their first house.
The Build Smart, Breathe Easier program is a partnership with Merck, Habitat for Humanity, and the Asthma and Allergy Foundation of America. And basically our focus is to build asthma-healthy homes here in the United States. And we're actually excited to be here in Philadelphia today to work on the home of Anna Johnson.
Asthma is a scary thing because there are some of the slightest things sometimes trigger it. I think it'll be a great improvement. Our old house, it has old carpeting. There's no carpeting here. There's a different type of paint being used here. I think it'll make a big difference.
We're trying to make an asthma healthy house. And the way we're doing that is through the cork on the floor, so there is no rugs where there's allergens. We're sealing in all the cabinets and the countertops so the allergens do not get out. And the painting is all done with Valspar paint, so the house is much, much more healthy than a normal house would be.
We want patients to be empowered. Control your asthma means decreasing the triggers. Much what you see here is about decreasing your triggers.
It's important for anybody that has looking to introduce an allergen reduction plan in their home to realize that it is a whole house concept. So it's important to look at the circulation of air through your home, also maintaining it by vacuuming and dusting it quite often. Be careful not to use any sprays to make sure that you're not actually introducing particles into the atmosphere. It's also important to remember that things like mattresses and pillows are usable items. They're not lifetime items, so if your mattress is more than about 10 years old, it's probably time to get another one. If your pillow is more than about 2 years old, it's probably time to get another one.
Today we have a ton of Merck volunteers, and they're all working on painting with our no VOC paint, which is pretty cool because we've taken some people who can paint really well, we've stuck them on the doors and the detail, and then some people who just want to throw paint on the walls, and we just put them on the walls with some big rollers, and I think they're all getting messy.
Merck is really committed to helping patients, and obviously Merck has a significant commitment to respiratory disease. It's a great opportunity for us to lead in that area, to really help patients who have a respiratory disease such as asthma, to really help them lead a healthier, better life.
As a Merck employee who also has asthma, I really appreciate that we have a commitment to people with respiratory illness, and I also think it's really important that patients with asthma live in environments that are free from triggers for their asthma.
It's working with somebody to help them, and I think it's great, particularly when the company can help employees facilitate their ability to help other people in the community. It makes you feel good at the end of the day.
And the opportunity to give back and to help out, help another family get into a home that meets their needs, that helps with their child who does suffer from asthma. And this opportunity, I think, is just great to be able to volunteer.
So if people want to go to buildsmartbreatheeasier.com, there's numerous tips, tricks. If they're not, building from scratch or they're not remodeling, they can learn a lot of different techniques that they can use or implement in their house to make it more asthma healthy.
What I'm looking forward to most in our new home is that this will be our home.
It's been a long time coming. I think it's worth the wait.